And finally, Rose Seavey is President and CEO of Seavey Healthcare Consulting. She's formerly the Director of the Sterile Processing Department at the Children's Hospital of Denver. Rose served on the AORN Board of Directors and is a past president of ASH-CSP. She received numerous awards, such as AORN's Award for Mentorship and Outstanding Achievement in Nurse Education. She was given the Isham Award of Honor, and Rose was named as one of the Who's Who in Infection Prevention by Infection Control Today. She's the author of the book titled Sterile Processing in Healthcare Facilities, Preparing for Accreditation Surveys, published by AMI, and it's now in its 3rd edition. She also serves on several AMI committees helping to write our national and international standards.
Hello, good evening, everybody. And, I guess that I'm the last speaker between you and your dessert that is down under.
Yes.
So I'll get started. Since I'm the last presenter, I had to have color to kind of do a little song and dance here, but basically I'm going to talk about traceability. Here's my 3 objectives. We're going to define what do we mean by traceability and the importance of it. We're going to talk about, I'm going to share with you the regulatory requirements around being able to trace products that are reprocessed from one patient to the other, and the examples of how traceability needs to happen with ultrasound probes. So does that sound okay? Good. So basically, what is traceability? Well, it's the ability for us to verify the location, as you were just saying, Amy, from the time we have the device, get the device, to all the patients that it was used by means of a documented, recorded identification. So we must document every patient that we use these probes or reprocess items on. So why do we need to do all this tracing? Well, I'm speaking to the choir here, obviously, but if there's a product recall, we know that that does happen. If there's an outbreak, we have to do some investigations. And sometimes for case studies, we need to know where these products were used. So record keeping is really necessary, obviously, for epidemiological tracking, but also the ongoing assessment of the reliability of our reprocessing methods. And we need that appropriate documentation to report the practices and enable the traceability of each product that was processed or used from one patient to the other. So what do our professional organizations say with our evidence-based guidelines? Well, first, AMI ST79, which we consider, we in the sterile processing world, see, I do live in a sterile world. What AMI says as far as the sterilization guideline for STEAM, under Section 13, product identification and traceability, each item or package that is intended to be used as a sterile device must have a lot control number, and that lot control number obviously has all our information for our sterilizers, et cetera, and that allows us full traceability of these products to the patient. Alternatively, we can use a barcode tracking system, which several hospitals have that now, but not a lot. But ideally, every product that is used from one patient to the other, or every reusable product, should be traceable. And the traceability can be accomplished in a couple of different ways: by recording the sterilizer load identification on the patient record, or by simply putting the patient's name on the load record. So what does ST58 say? For those of you who may not know, ST58 is our document for chemical sterilization and low temperature and high-level disinfection. And basically it says that items that are processed for immediate use by means of a liquid chemical sterilization or a high-level disinfection soaking systems, they don't require lot numbers. So they don't have, the tape attached to it, et cetera. But we still need some way to be able to identify and track these devices. And you can do that by maybe assigning the load to your soaking trays or the chamber, or whatever you're using. So what does our perioperative professional colleagues say? Basically that we need accurate labeling in order to provide identification on packaged items and to enable this traceability from one patient to the other. Now, let me just back up a little. You notice the AORN guideline says 2012. Well, that is in the process of being updated. It's already gone out for public comment, and soon it will be available, but it pretty much says exactly the same thing. The AORN brand new guideline that came out in January this year for manual chemical high-level disinfection goes into it a little bit further, saying that our records have to include all this information: the date and the time of our high-level disinfection, the description of the device, and the very unique identifier, maybe the serial number or however you identify that particular device, and then who did that processing, and then the patient that the device was used on, and then, of course, who was the physician doing the procedure. But in addition to that, we need to trace or track that information in regards to the chemicals itself. So you need the lot number, the shelf life date, activation date, reuse life date, result test strip, results of your minimal effective concentration, the temperature and exposure time. Whew, that's a lot of stuff to record, isn't it? And this is, you know, with the opportunity for human error can be kind of great here. Or, you know, the lack of actually documenting all that information. So, can we have that information? Well, how long do we have to keep that information? Well, it really is up to each individual facility, and it becomes a risk management policy. So the length of records that you must keep depends on state, local, and the policy in your particular area or facility. And so that is documented in ST79 and ST58, says pretty much the same thing. But what I really like about ST58 is it goes on to say that the record retention policy should be written with your legal counsel as well as your Infection Prevention and Control Committee. So we have to work together. If you were in my presentation just a little bit ago, it takes a village. That was a little self-present. Yeah, there. Anyway, the traceability of ultrasound probes. The probe processing record should be linked to the patient and the device. So, for instance, the patient record. So semi-critical and critical probes must be traced. But then we also have those probes that maybe can be used as semi-critical or non-critical, sort of, but you know, it might be used for both. Well, when in doubt, we really need to be able to trace that, because if it can be used for high-level disinfection or low-level, you should make sure that we are tracing that device. So the reprocessing steps and the use of the probes can happen in many different areas, as Roy was saying. So it may not be used in the area where it is actually processed. It may go out to 10, 15, 20 different areas and different people, etc. So we still need to make sure that all that traceability is still there. The traceability at the point of use, labeling ensures the traceability to the patient, and we know that sterilization is the gold standard. And with sterilization, we know we've got a terminal barrier, so it helps protect it from external environment. And also, it has the ability for us to label it with that lot number. Now, you apply that to high-level disinfection. Clean single-use covers to protect the probe in storage is how we kind of protect it from the environment. And with that, we can apply a sticker to that probe cover so that, you know, if it does go somewhere else, then we have that traceability. So that labeling helps us to ensure that you can distinguish between a probe that's been high-level disinfected or low-level disinfected, and we don't cross the two and have an increased risk of infection for our patient. So tracing it to the next patient, we have several different options. You could do the logbook, which a lot of facilities are doing right now. And the example, if you're doing manual soaking using a logbook, then you put all that information into the logbook. The manual entry would include like the concentration, the temperature, date, time, pass, fail of the chemical indicator, and the lot number. And then with that information in your logbook, you can trace it to the patient record in a couple of different ways. You could do that in option number 1. You could record the logbook entry number on the patient record, or you can put the patient information or their ID information because of HIPAA into the logbook. But now, what about traceability of the next patient electronically? Well, ta-da! That's one of the reasons you're here today. If you haven't been by the Nanosonics booth yet, you'll want to make sure that when you go down under, you will actually be able to see the second generation that has the traceability. So the electronic version, now we can, the devices automatically collects the data. And this is pretty cool. So that we don't have to write all the concentration, temperature, and date, and all that, and have the possibility of error. But the nice thing about that is you have the capability of matching that to the hospital information system, and then matching that to our patient record. So the benefits of paperless traceability is you have that electronic backup, you have the data storage, which makes it much, much easier to, if you need to go back into the records. The data is searchable by event in case you happen to have a recall, that particular lot or model number. Of course, it's HIPAA compliant because the records are stored electronically, and the option of being able to connect that with our hospital information systems. So in summary, documentation demonstrates the compliance with our regulatory and our professional organization requirements and identifies trends to quality improvement opportunities. So with that, Kathy, I guess I'm going to turn it over to you. Thank you.